I'm Dr. Kevin Cullen. I'm the director of the University of Maryland Marlene and Stewart Greenebaum Cancer Center. I'm a medical oncologist, and my clinical specialty is the treatment of head and neck cancers. In that role, I function with a multidisciplinary team of physicians, including surgeons, radiation oncologists, nurses, social workers, nutritionists, who, as a group, come together to evaluate and manage patients with this group of diseases. Head and neck cancer, this is an anatomical model, and head and neck cancer is defined as a group of diseases which arise from the oral cavity, the tongue, the tonsil, the voice box, and the throat. Many of the people who have these cancers have a history of either some exposure to tobacco or alcohol, but more recently many of these cancers are associated with human papillomavirus, the same virus that causes cervical cancer. And one of the advantages that we offer here at the Greenebaum Cancer Center is that we really function as a team, because the treatment of these diseases today requires multiple specialties to be involved. Frequently, patients will receive a combination of chemotherapy and radiation given together. Frequently, they'll have surgery either at the beginning or the end of their treatment. And really, that integrated team approach is what's critical to be successful in treating these illnesses. Research is a critical part of what we do here, and we have a number of areas of important research going on in head and neck cancer. On the basic science side, my laboratory and other collaborators have really helped define how papillomavirus impacts the prognosis of head and neck cancer, and very importantly, how differences in rates of papillomavirus infection have explained very long-standing differences in survival between black patients and white patients. That's something that's been out there for a number of years, and we really were able to demonstrate the root cause for that in a way that can impact treatment going forward. Other researchers in our group, Dr. Santha in radiation oncology, have led national clinical trials through the Radiation Therapy Oncology Group looking at cutting-edge treatments for this group of diseases. Dr. Strom in the otolaryngology head and neck surgery group has developed some very exciting new tumor vaccines which are in clinical trial for head and neck cancer, again resulting from the very strong research focus both on the clinical side and the basic science side here at the Greenebaum Cancer Center.